Children's mental health during the COVID-19 pandemic in Japan. As you know, the COVID-19 pandemic has prompted many countries to adopt social distancing measures, causing much disruption to the daily lives of their citizens. 7 types of coronaviruses have been identified. 4 types of these coronaviruses are familiar pathogens of the common cold. 2 types are known as SARS and MERS, respectively, which, along with their high mortality rates, became major problems in foreign countries a few years ago. SARS-CoV-2 was identified as the 7th coronavirus to infect humans, and it has remained potent as COVID-19. This presentation shows children's mental health during the COVID-19 pandemic in Japan. Introduction. Schools have shut down globally in 188 countries, and more than 90% of the world's population has missed out on some education, prompting UNESCO to warn of educational disruption. These school closures during the COVID-19 pandemic have led to social issues in many countries, causing many children to suffer from loneliness and fear of the unknown virus. In Japan, the Prime Minister ordered all elementary and junior high schools to close their schools temporarily from March 2nd through spring break in response to the explosive spread of the disease. On April 7th, the situation escalated dramatically with the declaration of a state of emergency. Cluster measures and self-restraint, mainly by health centers, were successful, and schools were reopened in June with a staggered school day. It seemed as if the spread of the infection was under control. But then, COVID-19 came roaring back, with the number of infections across the country increasing. With the unprecedented circumstances of COVID-19 spread, it is important to focus on children's feelings of helplessness and loneliness. Spread of COVID-19 from China. The first appearance of COVID-19 is documented in the WHO Situation Report Number 1. On December 31st, 2019, a case of pneumonia of unknown cause in Wuhan City, Hubei Province, China, was reported to the WHO China office. From December 31st, 2019 to January 3rd, 2020, 44 cases of pneumonia of unknown cause were reported to WHO. The causative agent was not identified during this reporting period. Chinese authorities identified COVID-19 on January 7, 2020, and on January 12, 2020, China shared the genetic sequence of this virus with other countries. Following the first case reported in Thailand on January 13, 2020, the virus spread rapidly. Within just a week, 4 countries had reported cases. China reported 278 cases, Thailand 2 cases, Japan 1 case, and South Korea 1 case, for a total of 282 confirmed cases of COVID-19. January 14th, 2020. In Japan, a patient with pneumonia and a history of travel to Wuhan City was reported by a medical institution to the competent health center. January 15th, 2020. WHO was informed by the Japanese Ministry of Health, Labor, and Welfare. A total of 314 confirmed cases of COVID-19 were subsequently reported worldwide on January 21st, 2020, including 309 from China, 2 from Thailand, 1 from Japan, and 1 from the Republic of Korea, according to the WHO Situation Report Number 2. By that time, 16 healthcare workers in China had been found to be infected. With this human-to-human transmission, the spread of the disease had entered an unknown phase. The battle against this unknown virus, with its sudden social restrictions and policy announcements, has increased a sense of uncertainty and isolation for all, and some adults and children may experience overwhelming anxiety and helplessness. After shipboard infection on board the Diamond Princess, COVID-19 pandemic spread in Japan. Impact of COVID-19 on children in Japan. Around the same time, the issue of shipboard infection on board the Diamond Princess began to attract public attention in Japan. A passenger on the Diamond Princess who disembarked from the ship on January 25th in Hong Kong was confirmed on February 1st to have contracted COVID-19. By April 15th, a total of 712 cases had been confirmed, with at least 14 deaths. A major problem at this time was that 9 people, including the quarantine officer involved and the ship's physician were also confirmed to have been infected outside of the ship. In other words, human-to-human transmission was also confirmed in Japan. On January 28th, in addition to patients with a history of overseas travel, including passengers on the Diamond Princess, a patient with no history of overseas travel was confirmed. In the absence of effective treatment or a vaccine, the most practical recommendation has been to utilize physical distancing to minimize transmission. The broad purpose of this recommendation has been to reduce the burden of COVID-19 on public health and health services and to allow time for disease prevention and control. The goal of promoting social distance has led to the closure of schools and a shift to an at-home learning model. The first school closures began in various countries around February to March 2020. Several systematic reviews written around April 2020 argued that there was little benefit from school closures. However, many new studies found a relation between school closures and the incidence of COVID-19 and estimated mortality. Between March 9th, 2020 and May 7th, 2020, school closure in the U.S. was temporarily linked with decreased COVID-19 incidence and mortality. States that closed schools earlier, when cumulative incidence of COVID-19 was low, had the largest relative reduction in incidence and mortality. Many clinicians and researchers have highlighted reports of the effectiveness of simultaneous school closures in preventing COVID-19 infection in children. But there were also several problems with temporary school closures. It could significantly disrupt the lives of students and their families and affect the health of their children. Therefore, we must consider the potential social impact of school closures on children's health and what can be done to mitigate the damage. From April, many schools started online classes, something they were unfamiliar with. Many teachers in Japan had never taught online before. In June, many schools gradually resumed classes, for the first time since March 2nd. As a result, summer vacation was shortened to 2 weeks. Students are compelled to wear masks on the way to school and during school. Refraining from going out, playing with friends, playing in the park, and a lack of education, a lack of classes, are all increasing the emotional burden faced by children. The number of patients with COVID-19 increased from July to August. Tokyo had a particularly high number of infected cases, and fathers were working at home more often. The late start of the new school year prevented schools from moving forward with their study programs, and many schools decided to shorten the summer vacation from 6 weeks to 2 weeks. Japan was struck by a second wave of the pandemic after the state of emergency was declared. In September 2020, the number of patients decreased again. Similar to other countries, the number of children infected by COVID-19 has been very small. This figure shows patients who were positive for COVID-19 by age. In Japan, there were no deaths under 20 and 1 death under 30. The death under the age of 30 was that of a sumo wrestler. 7 types of coronaviruses have been identified. 4 types of these coronaviruses are familiar pathogens of the common cold. 2 types are known as SARS and MERS, respectively, which, along with their high mortality rates, became major problems in foreign countries a few years ago. SARS-CoV-2 was identified as the 7th coronavirus to infect humans, and it has remained potent as COVID-19. The number of people under 20 years infected is small, and the rate of severe disease is small, not only in Japan. COVID-19 binds to the ACE2 receptor during its intercellular penetration. Previous studies show that the expression of the ACE2 gene is low in children. Estimating viral nucleic acid levels from newborns to 65 years of age has been investigated to gauge the potential role of children in the transmission of COVID-19. Although we are limited to measuring viral nucleic acids and not infectious viruses, the results suggest that young children can play a role in disease transmission in the community. There was an emergence of new pediatric cases of COVID-19 during the last 2 weeks of July in the U.S., with a 40% increase in pediatric cases in states with reopened schools. At this time, it's understood that children endure stay-homes and school closures and stay home to protect adults who are more susceptible and can be more severely infected.
Preventative Campaign for COVID-19 in Japan.
This is an ancient document from the Edo period. The Edo period was a time when there were samurai and shoguns. Yokai were indigenous monsters of Japan, believed to be living in various regions of the country, and there were said to be countless species. Yokai have been very popular with children from the Edo period until now. Yokai, amabie, is a Japanese symbol of the COVID-19 pandemic. Using amabie in the psychological education of COVID-19 for children is popular. Japan's Ministry of Health, Life, and Welfare has leveraged the character's popularity to raise awareness about the importance of staying home and physical distancing to prevent infection. The temporary closure of schools started on March 2nd through spring break and then continued with the state of emergency declared on April 7th. The countermeasures against clusters of COVID-19 and the self-restraint policy were successful, and the schools reopened in June after a staggered return to school. Two of the Japanese government's strategies for prevention are using the phrase avoiding 3Cs and the yokai character. Avoiding 3Cs indicates closed space, crowded places, and close contact settings. Awareness of the 3Cs in order to prevent infection is nearly universal among Japanese people. COVID-19 is changing our lives and affecting the minds of children in no small way. Its effects not only directly impact children, but also greatly affect the environment surrounding children, which ultimately affects the children even more. Measures being taken to control the spread of COVID-19 put children at a higher risk of neglect and abuse. Perhaps they pose a greater risk for children than COVID-19 itself. In addition to self-restraint intensifying problems in the home, removing the safety net of school compounds underlying issues. Children's unusual behavior at school often alerts families, but by living a life of self-restraint, the changes may go unnoticed. In some families, staying home together increases the likelihood of child abuse and neglect, and increases the opportunity for children to be harmed. The 22% increase in retail alcohol sales is limited to consumption in the home at this time, and it's important to emphasize the risks posed to children by issues such as parental alcohol dependence. To this risk, one could add the increased unemployment rate due to the self-restraint of activities associated with the spread of infection, which is becoming more apparent in some countries. These concerns are also evident in the increase in police response to children's phone calls and domestic violence cases. There is a lack of external oversight in the home to detect child abuse. Without regular access to teachers, school counselors, social workers, doctors, and other professionals, the routine opportunity to detect anomalies is lost. At the same time, the message to stay home and the fear of infection have led to a decline in emergency department visits by 25% and general clinic visits nationally. In fact, data shows that this has resulted in far fewer face-to-face visits on an international scale. Perhaps, just as the spread of infection is coming to an end, the issue of child abuse may be manifesting and may require care for children who have endured the helplessness of being unnoticed by anyone. In order to avoid irreparable trauma to a generation of children, we adults need to come up with a plan to protect them. In clinical settings, there are several medications that are covered by insurance for autism spectrum disorders and attention deficit hyperactivity disorder, and many children may be receiving treatment for these disorders. COVID-19 self-restraint measures create many challenges for children and their families, which may be further complicated by having autism spectrum disorder or attention deficit hyperactivity disorder. Children with developmental disabilities, such as attention deficit hyperactivity disorder, are particularly vulnerable to battling unknown viruses and the stress caused by social distance and self-restraint, and they may exhibit a variety of provocative behaviors. Highlighting this fact, the European ADHD Guidelines Group has developed guidance on the assessment and management of ADHD under COVID-19 infection spread. Compulsory education continues through junior high school. The local educational board manages all local children. In the fiscal year 2019, the number of children who refused school was 44,841 in primary school, which is 0.5%, and 119,687 in junior high school, which is 3.2%. 97% of junior high school students go on to high school. The high school dropout rate is 1.4%. Career paths after graduating from high school are university, 49.7%, vocational school 15.9%, and employment 17.5%. The impact of COVID-19 on psychiatric care has already been noted. COVID-19 has created unprecedented challenges at all levels of society, but many of the so-called developmental disabilities are diagnosed in childhood and will often lead to early and ongoing visits to child psychiatrists and pediatricians. This slide shows the number of outpatients who visited the Department of Child and Adolescent Psychiatry, Konodai Hospital, National Center for Global Health and Medicine, between April 2018 and July 2020.
This slide shows the result of comparing these outpatient insurance scores to the fiscal year 2018 monthly average of the insurance scores for these outpatients. Our consultation covered patients under the age of 15 at the first visit. Most of the study participants resided in Ichikawa City and the surrounding areas. Ichikawa is a fully developed residential area and a center for education. The population is estimated at 490,322 as of October 2019. It's the fourth largest population in the prefecture. The emergency declaration in April, after the onset of the pandemic, caused extensive damage to the hospital's operations. Clinical implications in education field. If patients have misunderstandings about COVID-19, clinicians should review accurate information together. Accurate knowledge can help reduce undue anxiety. Children's heightened anxiety is a natural reaction to unusual situations. The future feels unpredictable and tense under the pandemic. In addition, children are usually not able to recognize these effects on their own. Children are characterized by a tendency to develop physical symptoms in connection with changes to their emotional state.
Discuss changes in the child's mood and behavior, changes in appetite, sleep, and other aspects of life. Clinicians may ask children about the changes that they're feeling. A variety of changes can occur in this situation, so it's important to create an environment in which it's easy to talk about the changes and concerns without rushing to resolve them. Look for children's positive changes and positive changes as a family. For example, more opportunities to exercise together, developing interest in new things, and so on. Solutions to the problem of internet gaming require a strong relationship between parents and children in order to discuss and work together to address problems. Discussing the problem can cause rebellion and resistance from the child. Flight and fight reaction. It's normal for there to be a gap between the attitudes of the child and family towards this issue. The daily relationship between parent and child is important.
Key points of communication with the child.
Do not blame the child. Listen to what he or she says without criticism. Discuss the rules. Respect the child's will and opinion. Praise the child when he or she does well.
Conclusion.
Along with new coronavirus infections, we need to maintain children's mental health and give them education. The lockdown and school closures are stressful for children and adults. We need to use digital devices to educate children, and hopefully, face-to-face education will happen sooner rather than later.